Introduction to the topic. This presentation will discuss Aboriginal and Torres Strait Islander health in remote communities, as well as health literacy and cardiovascular disease in relation to linking culture to health, the determinants of health, and the application of culturally safe nursing. Felicity and myself will be presenting the importance of health literacy in remote communities. Jessica will be presenting links between culture and Aboriginal and Torres Strait Islander health. Saja, relevant Aboriginal and Torres Strait Islander health, social determinants of health related to cardiovascular disease. And Angela, considerations for culturally competent and safe nursing practice in relation to remote communities, health literacy and cardiovascular disease. So why is health literacy needed? According to the Australian Heart Foundation, cardiovascular disease is the leading cause of death for Aboriginal and Torres Strait Islander people, and Aboriginal and Torres Strait Islander people are more likely to smoke, have high blood pressure, and be obese. Health literacy is critical to Aboriginal and Torres Strait Islander people throughout their lives. Understanding information about health and healthcare services available is important for overall holistic health. For example, Aboriginal and Torres Strait Islander people who have health literacy and knowledge are more likely to prevent disease, seek health services, and manage individual health. Statistics. In 2011 to 2013, Aboriginal people had a higher rate of CVD than people of no Aboriginal descent, 27% and 21% respectively. Rates have increased with age, 9% from ages 18 to 34 and 60% from ages 65 and over. In 2012 and 2013, cardiovascular disease was 1.4 times as common, as well as both CVD and diabetes being twice as common while living in remote areas compared with those that do not live in remote areas. Connection to country. Aboriginal and Torres Strait Islander people have a strong sense of culture and connection to country. This impacts views towards health services and illnesses. Aboriginal and Torres Strait Islander people have a holistic outlook on health, where not only a person's well-being is essential, but the whole of the community's well-being is of utmost importance. Aboriginal and Torres Strait Islander people also have a profound connection to the land in which they live, referring to it as country. This connection to country is a holistic view not only about themselves but about their whole community, the land where they live and the ancestors before them. Aboriginal and Torres Strait Islander people do not like to venture away from country if they can help it. For example, if a remote Aboriginal and Torres Strait Islander person needed better access to healthcare, they might not leave country to obtain it. This is because remote Aboriginal and Torres Strait Islander people would not be receiving holistic healthcare, as they would be too far from country to access their cultural well-being throughout the community. Therefore, Aboriginal and Torres Strait Islander people's connection to country affects their views towards health services and illnesses. Perspectives of health and illness can be impacted by culture and health literacy through a shortfall of education and cultural support. A lack of social and emotional well-being through cultural support is a cause and prognosis risk factor for cardiovascular disease. These risk factors include a loss of country, culture, identity, and language. With a lack of culture in mainstream healthcare, remote Aboriginal and Torres Strait Islander people are less likely to access healthcare services. Remote Aboriginal and Torres Strait Islander people have insufficient access to education. This leaves a deficit in health literacy. Without health literacy, remote Aboriginal and Torres Strait Islander people cannot make informed decisions about their healthcare. In conclusion, Aboriginal and Torres Strait Islander people's perception of health and illnesses are impacted by a lack of culture in mainstream healthcare and a shortfall in education. Remote Aboriginal and Torres Strait Islander people lack a connection to health services through culture. Individual health needs can be overcome by cultural responsibilities. These responsibilities can impact the connection remote Aboriginal and Torres Strait Islanders have with all health services. This means cultural obligations are of more importance, leaving no time for health and illnesses. Chronic diseases such as cardiovascular disease can be an impedance on remote Aboriginal and Torres Strait Islander people's cultural obligations. For instance, healthcare services can be long and demanding, or too far away. So Aboriginal and Torres Strait Islander people could choose instead to delay appointments or even deny the existence of their illness altogether, to instead carry out their cultural needs. There are many reasons why remote Aboriginal and Torres Strait Islander people do not use healthcare services. For example, one would be a lack of culture in health services. This would make an unwelcoming environment to which remote Aboriginal and Torres Strait Islander persons would not leave their country to access a place where they would not feel welcome. Furthermore, culture takes a higher precedence over health and illnesses through the lack of the access to healthcare. Lack of education is associated with the health of Aboriginal and Torres Strait Islander people. Minimal education affects the Aboriginal and Torres Strait Islander people in remote communities in making healthy life choices. Poverty and poor living conditions is associated with cardiovascular disease. The government has agreed to strategies to improve the education standards and easier access to education. The level of education is a social determinant of health that is significantly linked with Aboriginal and Torres Strait Islander remote communities diagnosed with cardiovascular disease. A recent report by the Department of Prime Minister and Cabinet states that the lack of education has been associated with and is a contributing factor of ill health leading to cardiovascular disease. Smith also states in remote areas of Australia Aboriginal and Torres Strait Islander communities are more likely to suffer from cardiovascular disease compared to those in non-remote areas, 18% to 11% respectively. The socio-economic status of Aboriginal and Torres Strait Islander people is significantly associated with their health. Smoking is a major risk factor of cardiovascular disease. According to the health plan developed by Department of Health, Aboriginal and Torres Strait Islander adults are less likely to smoke if they have accomplished Year 12, have taken employment and earn a higher income. In addition, the health plan states high levels of education are associated with healthier lifestyle choices and improved health literacy. The Department of Health recognised that cardiovascular disease is associated with environmental factors such as poverty and poor living conditions, and Aboriginal and Torres Strait Islander people will remain at risk while socio-economic disadvantages and barriers accessing healthcare persists. This reinstates that the link between the level of education is linked with the risk of cardiovascular disease. Poverty reduces access to healthcare services as the means are not available to travel to and from health services as pay for the cost of the services. Improving the lives of Aboriginal and Torres Strait Islander communities who are affected by cardiovascular disease is of great urgency. This is because Aboriginal and Torres Strait Islander people in remote areas are 2.4 times more likely than non-Indigenous Australians to be diagnosed with cardiovascular disease. This is due to making poor health choices being an outcome of minimal health literacy. The need to target issues affecting educational outcomes takes precedence over other issues as it affects the future of the Aboriginal and Torres Strait Islander people. The Australian Government have agreed to improve the quality of schools in an attempt to allow easier access to education. To address health literacy for Aboriginal and Torres Strait Islander people who have experienced or experience cardiovascular disease in remote communities, nurses must enhance their cultural awareness, competency and safety to deliver effective healthcare. Strategies include identifying preventative and therapeutic strategies such as introducing prevention and treatment programs, risk factor detection, nutrition, physical activity and monitoring of improvement. These elements can provide an effective healthcare system in remote communities or by adhering to the provision of cultural safety and sensitivity. Culturally competent and safe nursing care includes a critical reflection of a nurse's own beliefs, values, and cultural heritage. An individual's values and beliefs and cultural heritage are all shaped by factors including race, nationality, language, ethnicity, occupation, and physical and mental ability. To be culturally competent and provide safe nursing care, all health professionals must integrate these factors into their delivery of professional patient care. This is to ensure each patient is receiving the highest quality of care possible regardless of their background, literacy and race. Examples include providing an interpreter for any barriers with language, providing training and education to all healthcare workers, and the importance of cultural competency and safe nursing care. Traditional healers and including family members into discussions and decisions making for the patient. Cardiovascular disease is one of the highest diseases in Aboriginal and Torres Strait Islander communities. The most common types of cardiovascular disease include heart failure, coronary disease, stroke, and high blood pressure. Risk factors include smoking, high blood cholesterol, lack of physical activity, bad diet, and diabetes. Communities in remote areas have higher risk of developing CVD due to the lack of services such as doctors, social groups, community groups, counselling, and medicine. In some cases, individuals of the Aboriginal and Torres Strait Islander community have to travel out of country to receive some sort of professional health care. Nurses who practice in a culturally competent and safe manner can understand and establish a professional relationship with the patient regardless of their cultural background. Nurses will respect each patient and their family member as well as working under the Nursing and Midwifery Board of Australia professional standards. Professional Standards 2.2 represent that nurses must communicate effectively and respectful of a person's dignity, culture, values, beliefs, and rights. However, nurses who do not act culturally competent and safe jeopardize their registration as a nurse and can face serious offences by not working under the nursing professional standards and codes of conduct. This can include a possible suspension of working for New South Wales Health, and fines may apply. Now for our summary. Many Aboriginal and Torres Strait Islander people are affected by cardiovascular disease, especially in remote communities due to the lack of effective services. Nurses must be culturally competent and deliver quality care to patients and take into recognition their culture, values, beliefs, backgrounds, ethnicity, and language. Health literacy is important in healthcare to obtain, read, and make appropriate health decision making. As a group, we have successfully met our aims and objectives by providing important evidence towards cultural competency and safety for Aboriginal and Torres Strait Islander people. By following the professional standards and codes of conduct, nurses can recognise the health and well-being of Aboriginal and Torres Strait Islander people and ensure they are safe and receiving professional nursing care. This will encompass important knowledge of cultural values and practices for Aboriginal and Torres Strait Islander people. Now to the conclusion. Nurses who are culturally competent and provide safe care can recognise the health and well-being of Aboriginal and Torres Strait Islander individuals and communities. This will enhance a stronger relationship and develop effective communication skills to deliver professional patient care. Nurses who follow these guidelines are demonstrating an understanding of the effectiveness of culturally competency awareness and safety and sensitivity. I hope you've enjoyed our slides and thank you very much for watching. Goodbye.